Have you ever considered a job that's behind the scenes but integral to the healthcare system? Let me tell you about the world of medical coding. Today we're unpacking the pros and cons of being a medical coder, everything from salary to work environment. I'm going to be dishing it all out. I'm Victoria Mull. I'm a medical coder, auditor, educator, and content creator, and on my channel I provide tips, tricks, and tutorials to help you be successful in a medical coding career. And today's video is sponsored by Preppy, but more on them in a little bit. So medical coding is the process of converting healthcare information and records into organized code sets so that we can use that for lots of different purposes. We often see billing and coding tied together because the coding's big purpose is for billing and reimbursement. We take the codes, we send them to the insurance company, and the insurance company hopefully pays it. So every diagnosis, every service, medication, equipment, that's all analyzed and converted into codes so that we can use it for things like reimbursement, but also so we have that data for things like treatment tracking, for population health, even things like budgeting for healthcare services. So I want to dish out some of the top pros and cons about a career in medical billing and coding, and I want to start with the pros. First pro is there is a lot of need for experienced medical coders. Healthcare has gotten so complex and over-regulated to some degree. So there's just, because of that additional complexity and all of the different records and consumption of healthcare services, there's a growing need for medical coders. If we look at the data from the Bureau of Labor and Statistics, health information technicians, which includes medical coders, is expected to grow in the next few years more than most careers, which is great because one of the big reasons people look into medical billing and coding and have historically is because there's a lot of flexibility. There's a huge amount of our workforce that works remote. A recent survey from the AAPC, which is the largest organization that credentials medical billers and coders and practice managers, they polled their members and over 63% reported that they were working remote, with over 15% saying that they were doing a hybrid of remote and in-person. So only a small percentage are actually working on site. Although oftentimes those on-site positions can be things like auditing or education or CDI, which makes a lot more than what the salary on average is for medical coding. So the next pro is the salaries. The salaries are pretty competitive. The average for a CPC, which is a certified professional coder, is around $48,000 a year, compared to say like the average Amazon warehouse worker, which is about $38,000. An administrative assistant is about $45,000, or if we keep it even in the healthcare perspective, a CNA makes about $41,000. But here's the better part, which is our next pro, and that is there is a huge amount of career advancement. I can tell you that when I left my last full-time auditing job before I went into business for myself, I was making around $70,000 a year and had insane benefits like healthcare and paid time off and sick days. And had I stayed on that path, I'd probably be making around $80,000 a year as an auditor. In fact, I know a lot of auditors that are making close to and possibly over the six-figure mark. It depends on what you're doing, but it's definitely possible. There's a lot of areas to grow in. You can specialize in certain specialties in healthcare, like interventional radiology. That pays very high. You can go into auditing, you can go into compliance, you can even go into practice management. There's a lot of different ways you can specialize in medical coding. And you know what they say? The riches are in the niches. In fact, I did a recent video where I broke down all the salary information for medical coders, how different certifications can impact your salary, and how different locations can impact your salary. If you want to see that video, I will link it here and then in the description as well. And the last pro is that medical coding may not seem like it, but it really does make a difference. The thing though is you don't notice when it makes a difference, you notice when it doesn't make a difference. So for example, if a healthcare organization is found to not be billing things correctly for a period of time and they have to reimburse millions of dollars to the insurance companies, especially the federal ones like Medicare and all the penalties involved, or when a patient has a service that wasn't coded correctly or sent out to insurance correctly and they wind up getting a very large bill in the mail that maybe they weren't due, that's when you know that things are not going well. So the goal is definitely to keep things smooth and keep things quiet. Now let's talk about some of the cons of being a medical biller and coder, because of course there's cons with anything. First is that it is kind of repetitive work, especially if you're stuck working on the same specialty. You might get a little bored of it until you can find a new specialty to work on. And depending on what specialty you're working on, which usually they have coders kind of focus on one thing. We're not going from like OBGYN over to hospitalist services, over to urology, over to cardiology. Like you kind of focus on one area. So it can be kind of monotonous. oftentimes with these electronic health records, you have a work queue and it's just like patient, 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 and you look at their data service and their records and code everything out. So it's just going through all that stuff in the system. The second con is there's a lot of continuous learning. So if you're someone who just thinks they want to learn something once and be done with it, it's usually not a good career for you. This is something that's really geared towards continual learners. And in fact, once you become certified as a medical biller or coder, you have to get continuing education units. Those have to be submitted every other year. So you have to do things like go to webinars or workshops or chapter meetings or conferences or do online quizzes. So you have to have that continual learning. Things change a lot in healthcare, codes change every year, and you have to keep up to date. Also, there is a lot of pressure on accuracy and productivity. With a lot of coding positions, they are accuracy and productivity based, meaning you have to complete a certain amount of charts an hour. I can't tell you how many charts that is because, again, it depends so much on the specialty you're working on, what sort of facility you're working on. If you have to access different systems, like that could slow you down and your rate could be different. So I can't tell you it's a certain amount of charts an hour because it really, really does differ a lot. And of course you have to be accurate because if things aren't coded accurately, there could be potential takebacks. Someone could do an audit. They could find all of these inaccuracies, and not only are they going to take back the money, they could potentially extrapolate and say, oh, well, if out of these 20 claims, we found 4 that were incorrect out of, 600 claims that you've submitted in the past couple of years, this many were probably correct, and we're going to take that. And we're also going to issue you penalties. So there could be some huge financial implications. Now, the third con about a career in medical billing and coding is, like a lot of jobs, it can be tough finding that first position. A lot of people are surprised that when they get certified, they can't immediately get that top tier coding position, and that they might have to work somewhere else in the revenue cycle that deals with codes, but your job title isn't medical coder. And of course, those people that can't find the job right away are very quick to take to Reddit or Facebook and just scream it at the top of the mountains and say, oh, medical billing and coding is a scam. Like, the entire industry is not a scam. And then the last con I want to talk about is the isolation, which is true of the remote work, and a lot of medical coders are remote workers. So you can have that isolation and that feeling of worry sometimes, like, oh, am I even doing this correctly? Because things are just going out, not feeling connected to your team. I went even through a period during the pandemic where I rolled out of bed, hopped into my office, and was there until I basically rolled back into my bed. So you really have to have an organization that's the right fit and have strategies in place to make sure that you don't go completely stir crazy. Now, how do you weigh these pros and cons and determine if medical billing and coding is right for you? Well, what you can do is you can sign up for my free career masterclass at medicalcodingmasterclass.com. The masterclass will give you the complete blueprint on how you can be job ready as a medical biller and coder in as little as 6 months, and how you can check off all of the boxes of like everything to do that. And online on your own time and without going into, oh yeah, student loan debt. And it will tell you too about Preppy, which is the program that I personally endorse. Definitely go and check it out, medicalcodingmasterclass.com. So medical coding is a career full of opportunities, flexibility, work from home, usually great healthcare benefits, but it, like anything, it has its downsides. So you definitely have to make a personal assessment of your goals in your life and your lifestyle and determine if this is right for you, if it's a good fit. If you're looking for more information on a career in medical billing and coding, I have lots of video on the channel. You can check out my entire playlist that I have put together right here. And if you have questions, definitely feel free to leave them in the comments below. Otherwise, I will see you guys in the next video. And until then, just keep on coding on.